Hello guys, I'm Tony and welcome to readmyiris. In this video, we'll be looking at the prostate gland. How on earth do I see a prostate gland weakness, you may be asking? Well, today, you'll learn how to identify prostate gland weakness in an iris, so you can then identify it in your father, uncle, grandfather, or even in your own iris. We'll look at what a son's passed down genetic prostate weakness looks like from a father with prostate cancer. We'll also go through the function of the prostate gland and the potential manifestations of a prostate gland weakness later down the line for young men. We will also talk about the complexity, causality of such an issue, and how this ties in with the great lymphatic system. Actually, it's because of the lymphatic system we can tie it in with lymphatic iridology. What not better than to look at this man's iris? This is an iris of a bloke who's had a history of prostate enlargements, also known as benign prostatic hyperplasia. 3 enlargements, 2 of which required surgical procedures. This pathology is one of the world's most common pathologies, affecting mainly middle-aged men and elderly men. It is known to be an age-related disease with no known cause, with no known cure, just treatments. In 55-year-olds, about 25% of men experience obstructive symptoms when urinating. In 75-year-olds, 50% complain of a decreased strength of the urinary flow. 90% of men over their 80s are affected. In autopsy studies, prostate enlargement increased from about 20% in men aged 41 to 50 years to 50% in men aged 51 to 60 years. Greater than 90% of men 80 or over. It looks like the possibility of complications is unavoidable for us, or is it? Let's get started here. Here we're looking at the left iris of a bloke who sadly had part of his enlarged prostate tissue removed, not just once, but twice, over a decade. This procedure is known as TURP, transurethral resection of the prostate, the gold standard of BHP therapy. When I took this photo, he was experiencing LUTS and BOO, which means lower urinary tract symptoms and bladder outlet obstruction. He was unable to freely pass urine for 2 days straight. Disclaimer: don't wait a long time to address difficulty urinating. After 24 to 48 hours of LUTS or BOO symptoms, seek medical attention. The content in this video should never be substituted for direct medical advice from your doctor or other professional medical clinician. I do not give medical advice, only information. First, to understand a prostate weakness, let's look at the location and the function of the prostate gland. The prostate gland is situated around the bladder neck. Normally, it will be the size of a walnut and weighing around 20 grams. When it is enlarged, it can grow as much as 150 grams. The prostate gland is an exocrine gland, meaning it produces and excretes seminal prostatic fluid into the ejaculatory duct to nourish the pre-developed semen post-ejaculation. pH of this fluid is alkaline, one important factor we will discuss later in this video. The prostate has 2 sphincters, an internal sphincter and an external sphincter. They interpose each other to allow seminal prostatic fluid to be excreted without allowing urine to mix in with it. The understood cause of the pathology comes in 2 parts. The first part is that the prostate gland takes testosterone that is in the blood and converts it to dihydrotestosterone, which then stimulates prostate cells to produce more cells. The second part to this is the delayed or reduced apoptosis, which means programmed cell death. As there are more prostate cells being produced and less cells dying, the prostate tissue ultimately enlarges. When this occurs, men may experience LUTS, which is short for lower urinary tract symptoms, and BOO, bladder outlet obstruction. Symptoms include slow to start urination or forceful straining to start to urinate. Not all the urine can be emptied. Weak urine stream, and finally unable to completely void their bladder or empty their bladder completely. Alright, so this is how we identify a prostate weakness. This is a demarcation line called the collarette. This separates the central pupillary zone, which shows the person's stomach tissue and its condition, and the outside peripheral ciliary zone, which will show all the organs in the body. So here you can see in the location at the 7 o'clock mark is the prostate gland, and below is the male appendage. You can see here in this location at the 7 o'clock mark, this is the prostate gland. You can see how these long stranded fibers to the prostate gland and the male appendage is all wavy. They're supposed to be straight, like over here. These straight fibers are called trabecular. What we're seeing here is the fibers going every which way. Here it's supposed to be nice and straight. When the trabecula are bending away, causing a dark hole to appear, this means that there is cellular damage or inflammation is present in the tissues. This bloke also has some kind of psoriasis on his appendage. The skin is dry and scaly, and you can see why, the cellular damage. The tissue is inflamed. What we can also see is swollen lymph nodes. What's supposed to drain the penis and the prostate has gone from white acute to yellow subacute. It's the only cluster of lymph nodes that's gone yellow. Everything else is still white. All these white dots around the outside are swollen lymph nodes. Lymph nodes that are not swollen won't appear in the iris. Look, a swollen lymph node here and there is not a problem. It's only when you get hardened lymph nodes when it becomes a problem. It will take a long while to get them soft again. Swollen lymph nodes, we can only work with them, but hardened ones takes a bit more work to get them soft again. Let's look at the right iris. We're looking at the 5 o'clock mark for the right side. Here again we can see the trabecula bending away and around the damaged or inflamed tissue of the prostate. The cluster of lymph nodes draining the penis and the prostate is also slightly compromised on this side. You can see it's hyper white compared to all the other lymph nodes, draining other respective tissues. Lymph drainage is worse on the left than on the right side. With lymphatic iridology, the blue eye is called the lymphatic type. You can see beautifully the lymph system and its stagnation. That is, if you know what you're looking for. So what I can see here is the lymph cluster that drains the prostate has become stagnant over time, and the lymph system has nowhere to eliminate lymph. It overflows down to the penis, part of the integumentary system. The body also uses this to eliminate waste, causing inflammation on the skin. The left kidney and the right kidney are two of the main organs to help eliminate the body's waste material. To understand the impact of lymphatic waste material on the prostate gland, we need to first look at the directional flow of lymph. This is the direction of lymph flow in the human body. All the lymph moves in a unilateral direction. There are 3 things you need to know about the lymph system. Material contained in lymph can cause damage to cells and tissues. Lymph is acidic in nature. Lymph system's job is to remove these acids, aka sewage system. The body's urinary system is one of the eliminating organs for lymph. Functioning kidneys do an amazing job eliminating lymph and blood's impurities out of the body. You will find people on a SAD diet, standard Australian diet, or a standard American diet. If their kidneys are filtering optimally, you will see mass load of lymph in their urine in the way of precipitate, which means a solid forming out of a liquid solution, or in short, sediment. A urinalysis of urine sediment using a microscope has been done, listing a total of 17 different urine crystals being excreted. 4 urine crystals that's in alkaline urine, and 12 urine crystals that's in acidic urine. There is 1 urine crystal that can be present in alkaline and in slightly acidic urine, and that's calcium oxalate, a crystal salt that forms out of oxalic acid. I'll link a PDF of a urine sediment atlas in the show notes, listing all the different urine crystals. What does this all mean? If you're producing alkaline urine, you will only excrete up to 4 types of waste crystals, compared to 12 types when your urine is acidic. Naturally, your urine pH should be acidic, just like when you're a baby. When your mother didn't change your nappy in a timely fashion, you get a nappy rash. This is because your urine is acidic in nature, causing inflammation of the skin. When your urine is no longer acidic and your urine contains fewer or no lymph material, this means that your kidneys have decreased a unit of function, an important function. Where do you think this form of waste material goes if it doesn't come out of your urine? This means that the lymph waste material is being bottled up in the body, causing inflammation on the inside. If you have any pain within the body without any trauma, this is inflammation within caused by stagnation of lymph. Whoa. Wait just a second. Isn't this lymphedema? Medical definition defines lymphedema as a blockage of the lymphatic vessels leading to fluid retention. It looks more like a kidney to one side not filtering out all the waste material, then a blockage of lymphatic vessels occurs. When lymphedema is occurring bilaterally, you would want to look at the kidney on the side the retention is happening on. Here is a person's left iris with stage 1 lymphedema, and you can see there is a massive kidney weakness to the left side of the body. This black hole here is also known as a lacuna. This iris pothole is the same shape as the kidney itself. In a PubMed case study, found a clinical correlation with nephrotic syndrome and lymphedema. Nephrotic syndrome is a type of kidney disorder. The condition causes swelling mainly to your feet and ankles and increase your risk to other health problems. In this case study, 2 patients, a 3-year-old girl and a 7-year-old boy, developed lymphedema to one leg 1 year after the onset of nephrotic syndrome. Causes of this type of kidney dysfunction are hypertension, diabetes, sclerosis, and autoimmune immunological issues that attack the kidneys, causing inflammation. There needs to be damage to the functional units of the nephrons in the kidney. Then the appearance of lymphedema occurs. How much damage to the kidney will result in how much edema is present. When this important function of the kidney is impaired, lymph cannot be eliminated, and accumulation or stagnation will set in. Chronic stagnation will cause dysfunction and inflammation. There will also be a buildup of interstitial fluid. As it gets more congested, the clearance of lymph is further diminished, and then tissue enlargement develops. The perfect example of this is when lymphedema worsens. The lymph flow in the lymph vessels is diminished, the subcutaneous fat becomes fibrotic and hard, sometimes painful to the touch. Sometimes small lumps will form within the tissue and can further impair lymph flow. Then you get lymphorrhea, leaky legs or weeping legs. This is when excess fluid leaks out right out of the skin. Let's now have a look at where lymphatic stagnation starts from. First, the kidney tissue itself will be saturated with lymph, and it has a downward direction of stagnation, like a traffic jam, crash site at the kidneys and backlog of cars all the way down the line. So lymph at the kidneys are blocked and down the line lymph goes. First kidneys and adrenals, the bladder, then the prostate gland. This is lymphatic stagnation in the lower abdominal region. Here we have an unfortunate gentleman which has had the textbook lymphatic stagnation in the lower abdominal region occurring. He had kidney cancer, bladder cancer, and benign prostatic hyperplasia or prostate enlargement. So here we have the man's left iris. You can see the white in his eye that shouldn't be there in the lower portion of his iris. This is lymphatic stagnation. This radii solaris or toxic tunnel is the left kidney which sadly he had removed due to the kidney cancer. With a kidney weakness, you may be prone to hypertension, prone to kidney stones, prone to lower back pain in the L4, L5 region. Poor lymph flow in the kidneys will indirectly affect lymph flow in the lower back, causing stiffness and rigidity. Look at this huge back weakness here. You can tell the kidney was very acidic and under a lot of inflammation. Cancer comes out of an acidic or an inflamed environment. Then we can see the next organ being affected is the bladder, a notable weakness here. Then the prostate gland, which doesn't look too happy at the moment. This stagnation of acidic waste that should have exited out of the body at the kidneys is now causing inflammation and enlargement at the prostate gland. Here you can see some sediment at the bottom of this jar. You don't want your urine to be clear. If your urine is clear, then where are the acids? Where is the waste? The waste is being accumulated within the body. This waste product that's not being removed by the body, causing damage to tissues. This is the beauty of lymphatic iridology. Any weaknesses, any pain you have in your body, there's a lymphatic component to it. This is how we can see through lymphatic iridology where there's issues within organs caused by lymphatic stagnation. So lymph is acidic in nature, Lymph material can cause damage to cells and tissues in the body. The lymph system's job is to remove these acids through the kidneys as cellular waste excretions. This can be seen as sediment in urine. The next question is, how can lymph material cause damage to cells and tissues? Well, this is only due to the acidic nature, as it is comprised of biochemical byproducts excreted from cells called metabolic waste, and these byproducts are inabsorbable waste materials deemed a toxin to the body. This is now left to the lymphatic system, also known as the sewage system, to remove them. If you don't think the lymphatic system is responsible of removing toxic waste from the body, I highly recommend you look into the newly discovered lymphatic system. This system rids of toxins from the brain and spinal fluid and is only active during sleep. Think about it. What toxins are there in the brain? Where did it come from? The chemical byproducts produced from metabolism are your toxins. So people with prostate inflammation and prostate enlargement, they're just people who cannot remove cellular waste effectively. Do you think that's the case? Well, yes. I want to share an example of this. My father-in-law and mother-in-law came into the country on a 12-month visa. My father-in-law had a history of medical conditions, and one of them is prostate enlargement. So here you can see, in the location at the 7 o'clock mark, is the prostate gland. He's had part of his enlarged prostate removed back in his country. Let's do a side-by-side so we can see prostate weakness in a blue eye and a brown eye. These men are both in their 60s. They both have multitudes of weaknesses, but in this video, we'll only be looking at the prostate gland. Both men's age fall right into the medical statistics of benign prostatic hyperplasia. So first thing, when my in-laws landed, we checked their urine sediment. And surely enough, my wife's father had very little to no sediment. My wife's mother had heaps of sediment, more sediment than my kids. Towards the end of their stay, about 10 to 11 months later, my wife's mother started complaining about a minor neck and upper back pain. I decided to check her sediment again, and surely enough, there was very little sediment, much less than the first urine sample we took. Not long after that, they returned to their country. She lost weight very rapidly with no reason. After a few doctor's appointments and examinations, they found she had developed polyps in her colon, which she then had surgically removed. So what I'm saying is that these polyps are the body's toilet or rubbish bins. When waste cannot be removed, the body develops growths. Sometimes when it's a larger growth and it is surgically removed, many smaller growths come back all over the place. Don Tolman once said, if the body is not eliminating its waste products, the cells will provide its own rubbish bins inside of the body in the form of tumors, polyps, cysts, and cancers. When these kinds of growths are removed, the cells in the body have an emergency meeting and they say, hey fellas, where's our rubbish bin? Someone's removed our rubbish bin. We need to make new rubbish bins and we need to spread it everywhere. So if we lose one, we still have many other bins left. And in this manner, polyps, tumors, growths, and cancers may come back, sometimes more aggressive than before.
How's the recovery been this time? I know after your first surgery you bounced back quickly, but
yeah, I think
tougher now.
Yeah, I think it's definitely tougher than what it was the first time around. It's dug deeper in my brain to where the initial part was taken out. So, yeah, for whatever reason, it's definitely harder this time than it was the first time to get through it.
I mean, when you look at what's coming, will we have another chance to sit down and talk, do you think?
Johnny Ruffo, who was a former actor on Home and Away and a competitor on X Factor, has away at the age of 35. Ruffo was initially treated for his brain cancer in 2017 by having surgery to remove a tumor. However, the cancer reappeared in 2020. Ruffo disclosed that he had been given a fatal prognosis.
So if cellular waste can cause these kinds of growths, then the next question is, where exactly does cellular waste come from? Remember that where there is any chemical reaction, there is always a chemical byproduct. For example, your vehicle, when you burn petrol in your engine, you'll produce exhaust fumes. When you breathe, you produce CO2. ATP, energy production, also produces its biochemical byproducts. These byproducts can no longer be utilized by the body. We call this cellular metabolic waste material, which is then deemed a toxin. Don't forget, when you're exercising, you're producing lactic acid, another byproduct. The cells of tissues will use up nutrients and then excrete its waste byproducts into the interstitial spaces of cells. There it lies and waits for the lymph capillaries to move it to the nearest lymph vessels and then lymph ducts, and then taken away. With our lymphatic system, you'll notice something. It works in conjunction with the integumentary system. The average adult has approximately 2 square meters of skin with approximately 2 million sweat glands. They are mostly concentrated on our forehead, palms, and the bottoms of our feet. Look carefully here. There is an absolute reason for that, and that's because they are at the distal ends of our body with the least amount of lymph nodes, meaning it's easier just to drain directly out of the body from these locations without going through the lymph vessels, ducts, or lymph nodes. Our sweat is slightly acidic. If you ever let sweat run into your eyes, it causes irritation. This is because the fluid in our eyes has a pH of 7.4, and the pH of our sweat is slightly lower, ranging from about 5.7 to 7.3. Everything that is excreted from our body should be acidic. Sweat, urine, CO2, also known as respiratory acid, and fecal matter. When any one of those acids are retained by the body, problems will occur. Some may be minor or even lethal. For example, fecal retention, urine retention, blood clotting, and lymphatic congestion. When normal avenues for acid removal is hindered, the body will use any orifice to remove them. For example, if you're highly acidic, secreted seminal prostatic fluid can be in turn acidic. Normal men have semen pH balance of about 7.3, rendering it more alkaline. Higher alkalinity could mean chronic bacterial prostatitis, like this gentleman here. He has a prostate weakness, and he has prostatic seminal fluid pH measuring 8.0, which is deemed by the World Health Organization as abnormal. This could also mean prolonged prostatitis, which could lead to prostatic calculi or prostate stones. The makeup of prostatic calculi is mainly the alkaline mineral calcium. Calcium deposits could be one reason the pH of semen could be abnormally high. It is reported that prostatic calculi are seldom detected in children, unusual in young men, and common in middle-aged and elderly men. Prostatic calculi are mostly regarded as a physiological result of aging in elderly men, but have been correlated with inflammation in young men. In addition, prostatic calculi are more commonly found in men with prostatitis, benign prostatic hyperplasia, and prostate cancer. There are a few systems the body uses to negate acids building up in the body, and in this case, prostatic calculi or prostate stones, also known as calcium deposits. We know what happens when babies' nappies are not removed in time. Look what happens to the skin. It gets inflammation. Because of what? Because of acids. What is inflammation then? Acids is inflammation. The body will combat inflammation, aka acids, with an alkaline mineral, usually calcium. As we age, our ability to remove cellular waste, which are acidic in nature, diminishes. So in turn, acidic levels increase, causing more and more inflammation inside of the body. The more congested lymph in the body, the more acidic the body becomes, resulting in more inflammation. Let's look at a statement Jesse, a biochemist from Glucose Revolution, says about the human body.
To explain it properly, we need to cover cooking a chicken. So what am I talking about? So you know when you put a chicken in the oven and it goes from pink to brown, well, it has cooked. And this cooking process is called glycation. Glycation is like cooking. Now, what's interesting is that from the moment you are born as a human being, you are slowly cooking. I know it sounds weird, but it's true. You are slowly glycating from the inside out, just like a chicken in the oven. For example, when scientists look at the cartilage of babies, it is white. When you look at the cartilage of a 90-year-old person, it is brown. It has cooked, it has glycated, just like the chicken in the oven.
So looking at this through the lens of the lymphatic system, given a baby is born from a mother with a healthy lymphatic system, the baby will have normal levels of lymph production, lymph movement, and lymph excretion. Wait, did you know that pregnancy predisposes a cancer risk of 1 in 1,000 to the pregnant mother? If a mother's lymphatic system is already burdened by her own body's lymph material, aka the sewage system, introducing a baby may overburden her lymphatic system further. The mother-to-be is not only removing the waste of her own body, but now for the baby too. Diagnosed with stage 4 cancer while pregnant. Diagnosed with breast cancer while 2 months pregnant.
I'm currently 18 weeks pregnant, which I'm very excited about. But when I was 12 weeks pregnant, I found out that I had breast cancer. I had felt a lump.
Diagnosed with cancer while pregnant.
In Cherry's arm, the diagnosis wasn't good, and she's pregnant and they can't do anything.
Long story short, got diagnosed with cancer, which was like a massive shitter.
You've said that twice now, where it's like, oh, it's all good, but like,
It was horrible, but
I know, but you're saying it for the cameras, like, yeah, it's all like. You said like, got diagnosed with cancer, no biggie, like hell,
it's gonna
man.
make me cry.
But you're definitely just playing it down, but it was horrible.
This important topic I will discuss in another video. So it's the acids that build up as we age that actually promotes and ages us, and ultimately these acids will be our demise. So it's a game of how can I move and slow the acid buildup to promote long and lasting health. Remember, acids are on the side of chemistry that represents heating, stripping, and burning. Find me a paint stripper with alkaline chemistry. It does not exist. Let's list some acidic events. Extreme exercise, stress, consuming acid-forming foods, and lack of sleep is an acidic event. For example, when you have lack of sleep, let's say 2 hours, your eyes become bloodshot red. When you get enough sleep, the sclera turns white again. A child's sclera is always usually white. When we get older, the whites of our eyes are more and more red. This is one indicator to show that you are increasingly acidic. When eyes are bloodshot, it shows how thin the capillary walls are, letting blood bleed out of the blood vessels. Let's look at gingivitis. Look what happens to teeth with acid buildup in the gums. Anything with an itis in it, it is inflammation caused by acids. Acids has the ability to waste away enamel, dentin, and all the layers of minerals of teeth. Enamel is made up of calcium phosphate, which is a very hard mineral. If acids can break down enamel, the other minerals in a tooth really has no chance. Acids thin the capillary walls in the gums, causing them to bleed more easily compared to healthy gums. We men all have the same anatomy, but very different degrees of lymphatics. What I mean when I say different lymphatics is that there is degrees of stagnation that differs from man to man at the prostate gland. Human beings are mostly water. Water must keep on moving. Stagnated water is dead water. If any of our fluids stagnate, issues will occur. Just like the material in the lymph system, when lymph congestion occurs, inflammation will follow. When you realize this, you will understand how important it is to be focusing on your lymphatic system. Thanks to lymphatic iridology, It gives us an ability to see where the body is stagnated and genetically weak. Let's look back at our blue-eyed gentleman with the history of prostate enlargements. You'll notice a kidney weakness associated with it. Here is my father-in-law's eye. You'll also see a kidney weakness. Men with a prostate weakness, one thing that you will notice associated with it. This is the common denominator among men with BPH or a prostate weakness. There are 2 clinical studies that correlate kidney dysfunction and prostate enlargement. One study is on gout. Gout is a pathology that occurs when uric acid is ineffectively excreted by the kidneys. When this happens, uric acid can build up, forming sharp, needle-like urate crystals in a joint or surrounding tissue that cause pain, inflammation, and swelling. The study had a reasonable sized cohort of patients, 29,269 patients with gout and 29,269 patients with no gout, was monitored from 1997 to 2010, about 13 years. The results suggest that male gout is positively related to BPH, particularly in young gout patients. The second clinical study is the association of hypertension on benign prostatic hyperplasia, BPH. Hypertension is also known as high blood pressure. Kidney-related causes include kidney disease, inflammation to the tiny filters inside the kidneys, vasoconstriction of arteries supplying blood to the kidneys. The purpose of this study is to determine whether the intensity of benign prostatic hyperplasia symptoms and arterial hypertension are associated. We concluded that a significant age-independent association exists between benign prostatic hyperplasia symptoms and hypertension. Another similar study also confirmed this. This study confirmed a significant correlation between hypertension and prostate size in all subjects. 35 animal models of hypertension likewise support an association between hypertension and the development of benign prostatic hyperplasia. Spontaneously, hypertensive rats, a commonly used model of genetic hypertension, were shown to develop rapid prostate cell proliferation and BPH, whereas their normotensive counterparts did not develop such features. So when it comes to lymphatic drainage or acid removal, the left kidney drains the left side of the body and the right kidney drains the right side of the body. Nurture your kidneys to nurture your prostate gland. This is one of many ways to look after your prostate health. A simple non-invasive diagnostic tool is urine flow. Strong urine flow without excessive foam or bubbles. However, a strong flow does not free you from prostate problems, because some men may still be suffering from BPH and have no symptoms. Some people with slightly enlarged prostate can have major symptoms. Others who have very enlarged prostates can have minor problems. And some people with enlarged prostates don't have any symptoms at all. Some other health problems can lead to symptoms like that of an enlarged prostate include urinary tract infection, inflamed prostate, narrowing of the urine, bladder problems or kidney stones, bladder cancer, and prostate cancer. Now we're going to look at an eye of a man in his 40s with no symptoms of BPH or BOO, but his father is suffering from prostate cancer. This is what a genetically weak prostate looks like. The radii solaris or toxic tunnel emanates out of the pupil, cutting through both zones, the pupillary zone and the ciliary zone. This man's father and uncle was diagnosed with prostate cancer. A weak prostate runs in their family. This is called a first-degree organ-specific family weakness. The uncle's prostate cancer was in remission. Unfortunately, it came back more aggressive, spreading to his bowels, now diagnosed with prostate and bowel cancer. Even though we don't have the uncle's eyes, just by looking at the nephew's eyes, it can give a good indication of their family's genetics in relation to their bowel wall and prostate gland. You can see the demarcation line here. It shows the condition of the person's bowel wall. The bowel wall itself is lymphatically compromised, meaning lymphatic congestion interstitially. It's full of lymph. This lymph not moving will cause problems. So the nephew also has genetically weak bowels. He needs to be careful. I want to show you on this man another genetic weakness to the head and brain. This in reality for him interprets to hair loss and myopia. Genetics is a powerful risk factor, but it's not the primary risk factor. The primary risk factor is environment, diet, and lifestyle. Here's another man in his 50s, whose father also was diagnosed with prostate cancer. Again, you can see a toxic tunnel, also known as a readmyiris, emanating out of the pupil, cutting through both zones. This is a first-degree organ-specific weakness. He also has genetic weaknesses in the brain, interpreting to vision impairment and right side temple headaches. This will be caused by lymphatic pressure. This man's mother also suffered from dementia, which we will discuss in another video. Acids deteriorating the brain. Next, we're going to talk about the pelvic cavity that houses the prostate. The pelvic cavity can become easily acidic. The pelvic cavity holds your pelvic viscera, many organs which include your sigmoid colon, your entire rectum, your uterus, your bladder, and your prostate gland. All these organs are in a closely knit space, and all these organs are made up of cells. And all these cells of these organs are turning over and producing metabolic waste. If these aren't removed by the body, then an acidic environment will be created. Acids love to suck the body's calcium. Where is the most abundant calcium in that area? Your pelvis. Why do you think with age, pelvic bone density diminishes? The acids are just sucking the calcium right out of the pelvis, causing it to be fragile and weak, breaking easily after a fall. Now let's look at other clinical studies relating to manually modifying lymph flow to increase and improve prostate health. The first study we're going to look at is frequent ejaculation and infrequent ejaculation and its association to the development of prostate cancer. Once it was believed that frequent ejaculation was an associated cause of prostate cancer. However, many studies have found an inverse association. An 18-year Harvard study determined that risk of prostate cancer was reduced by 20% for men who ejaculated 21 times a month. That's 3 times a week, compared to men who ejaculated 4 to 7 times a month. So during ejaculation, it causes rhythmic contractions of the prostate gland. During these muscle contractions, it forcefully presses or squirts stored prostatic seminal fluid out the urethra. Here it mixes with sperm cells and fluid from the seminal vesicles to create semen, which the body expels. The alkalinity of semen helps neutralize the acidity of the vaginal tract, prolonging the lifespan of sperm. It is plausible that greater frequency of ejaculation and repeated contractions of the prostate gland propel stagnated lymph down the lymph vessels, helping with and improving lymph drainage at the prostate. Long-distance professional cyclist Lance Armstrong was diagnosed with stage 3 advanced testicular cancer. Let's look at the science. In the wake of a 2014 study that discovered a direct relationship to long-distance bicycle riding and prostate cancer, the risk of prostate cancer is 6 times higher for riders putting in over 8.5 hours per week than those riding 3.75 hours a week or less. They have a lower chance of diagnosis than non-cyclists. If we look at it through the lens of the lymphatic system, whilst the cyclist is seated, the skinny bicycle seat design puts upper body weight pressure on the prostate gland. In this seated position, lymph drainage is impaired, slowing or stopping lymph flow altogether, causing inflammation. Another clinical study looking at the increase of prostate-specific antigen, PSA, pre- and post-bike ride with interesting results that surprised the medical experts. According to the results of the study, cycling caused an average 9.5% increase in PSA when measured within 5 minutes post-cycling. This change is clinically significant as the cyclists used were all healthy males who are over 50 without BPH, prostate cancer, prostatitis, urinary retention, or history of prostate operation of any kind. I want to show you guys something else that relates to what I'm saying. A bloke during a water fast developed cellulitis on his right side, which is inflammation of the salivary gland. This is where he described it to be swollen and tender. It is the right parotid gland. I got a picture of his right eye and we can see here 2 weaknesses that associate with what he's experiencing, ear and upper jaw. Look at how deep and dark the readmyiris, aka toxic tunnels, are in these locations. Let's look at a clinical study. Does fasting during Ramadan increase the risk and development of cellulitis? During the month of Ramadan, the admission of Muslims with a diagnosis of acute cellulitis was more than double than that during the other months of the year, a difference that was found to be statistically significant. concluding that there is evidence that fasting in Ramadan may increase the risk for the development of acute cellulitis. So during Ramadan, when Muslims are fasting, their jaws are not moving, indirectly causing the lymph in the salivary glands to build up, causing stagnation and lymph congestion. This leads to the gland becoming swollen and inflamed. This is the location of the parotid gland, thanks to the anatomy lab.
You're looking at a lateral facial dissection, and you're probably going to easily recognize that this is the external ear, but I want to focus right in front of it. This is a salivary gland called the parotid gland. And this is a massive salivary gland, and it's one of three. The other two would be down in this area around the cheek and under the tongue. But this is going to produce somewhere around 20% or so of your total saliva.
Muscular contractions is the next big mover of lymph. Let's look at another study, exercise and prostate inflammation. A study published in 1998 of around 30,000 men, researchers found an inverse relationship between physical activity and BPH symptoms. Simply put, men who were more physically active were less likely to suffer from BPH. Even low to moderate intensity physical activity, such as walking, at a moderate pace yielded benefits. Walking 3 hours a week was associated to an extra 10% reduction in risk. Researchers also found that men who spent the most time watching television and videos, 41 hours per week, were twice as likely to develop symptoms of BPH than those who watched the least, 5 hours per week. And interestingly, spending more time on the couch watching television led to more cases of BPH regardless of how much time was spent exercising. My father, he falls perfectly into the medical statistics, yet he has no BPH symptoms at the age of 72. He's the first generation arriving into Australia, and without any English, he worked only labour-intensive jobs nearly all of his working life. Here is his iris. He has a prostate weakness. However, his occupation has had protecting benefits on his prostate. To further explore the relationship between physical activity and BPH, Italian researchers examined occupational and recreational activity levels of 1,369 men with BPH and 1,451 men without it. The men whose jobs involved strenuous physical activities such as farmers and construction workers were 30 to 40% less likely to develop BPH than men with desk jobs. Men who engaged in 5 or more hours of exercise a week were 30 to 50% less likely to develop BPH than men who exercised less than 2 hours a week. Men who has had the highest level of both occupational and recreational physical activity were 60% less likely to develop the condition. Other important studies looked at significant occupational effects on prostate. The highest risk estimates for prostate cancer of 25% was revealed for shift work. Pilots' occupation had an increased risk of 41%. A relatively large number of studies have examined a cancer risk among flight personnel. They are also exposed to ionizing cosmic radiation, which is carcinogenic. Therefore, an increased risk of cancer can be caused by multiple exposures. The results yielded a non-significant increase in risk of prostate cancer for flight personnel, and an excess risk of cancer was significant for pilots only. Time spent on long-distance flights were measured in block hours, which was the sum of time from the departure gate to the arrival gate. It was observed that the relative risk of prostate cancer in pilots older than 60 years of age increased with the number of block hours. Relative risk of prostate cancer for pilots was higher with more than 10,000 block hours, compared to the pilots with less than 5,000 block hours. This study proves that movement is a key component to prostate health.
Alright, so how do I check if I have a prostate weakness? Step 1. Take a photo of your iris using a light and your smartphone. You may need your partner's help with this. Check the 5 p.m. mark on the left iris and the 7 p.m. mark on the right iris. The reason you're looking at the left and the right iris is that our body exhibits bilateral symmetry. The left side shows the left side of the body, including the left side of the prostate, and the right side shows the right side of the body and the right side of the prostate. Don't forget to also look at the kidneys, which sits just past the 6 p.m. mark on the left iris and just before the 6 p.m. mark on the right iris. Remember, if you have a kidney weakness, you will be prone to hypertension, prone to kidney stones. Weak kidneys will indirectly affect the lower back, causing pain in the L4-L5 region. If you already suffer from hypertension, like this gentleman here, it will most definitely increase your risk of BPH symptoms. If you have trouble deciphering your iris photo, you can contact me direct and I can look at it for you in a complimentary consultation. We will look at and talk about your prostate and kidney weakness, if any. Also, if there is any prostate and kidney genetic predisposition. So you have a prostate weakness, either with or without BPH symptoms. What can I do about it? Step 2. Check if you have sediment in your urine. Pee into a jar and leave it in a place where there is no sun for 2 to 4 days. If you are filtering well, the urine will become cloudy. Bits of sediment and sometimes mucus will be visible. If your urine is clear, that means that your kidneys are not properly filtering. This means the cellular waste products are being filtered inside of you. If this is the case, then a diet change is crucial. If in fact you are getting some sediment, that is great news. Yes. It means that your kidney's filtering ability is functioning. You will now be working on maxing out the quantity of sediment. Cellular waste should be removed every time you urinate, meaning every time you go to the toilet to urinate, the maximum amount of cellular waste should be excreted. Step 3. The benefits of fasting is incredible, and it's been around for thousands of years, from biblical times to modern times. People are fasting for various health benefits, including cancer patients. They will fast before their chemo or radiation to lessen the ill side effects. Fasting the body bolsters up the cells and protects them from damage. Just fasting alone will increase kidney cellular waste excretion. This is an advanced 3-day detox cycle. I also have a 7-day ultimate detox guide and a 7-day soft start detox guide. This is for those who have never detoxed before. I know that everyone's different in terms of needs and their levels of health. That's why I have many detox guides to alternate and choose from. If one doesn't work for you, you can try another, all allowing the individual to achieve their optimized health. Please note, during the anti-inflammatory diet, all pro-inflammatory foods will be avoided. Processed foods, junk foods, soda drinks, milk and all dairy products, breads, rice, wheat and grains, cooked foods, alcohol and spices. If you are edemic, meaning your legs and ankles and feet are swollen, stay away from juicing and stick to consuming your fruits, berries and melons. Disclaimer, any detox diet that you're going to try should be approved by your doctor. Please see medical advice before undergoing any diet change. A person who has blood sugar problems should avoid fasting. Side notes. Avoid cycling more than 8 hours per week. This has been scientifically shown to increase prostate PSA. If cycling is your form of exercise, try and get an ergonomic bike saddle to relieve the pressure at the prostate gland. Sleep 8 to 10 hours a night. Exercise 3 to 5 times per week, preferably walking if that's all you can do. Evidence has shown that just walking will lower your chances of BPH. If you are overweight, intense exercise is not recommended at this stage. Decreasing the inflammation of the body will be the top priority. If you are overweight and exercise straight off the bat, injuries to joints or strains may occur due to all the inflammation in the body. You may in fact hurt yourself. Remember, to address our prostate problem, we must be working solely on our lymphatic system. Drinking water for our lymph system, eating foods that benefit our lymph system, sleeping for our lymph system, exercising for our lymph system. If we aim everything on our lymphatic system, then we will be moving in strides to lower inflammation and fully optimizing our health.
If you got your iris photos handy and have any questions about your prostate or any other weakness in the body, please don't hesitate to contact me for a free 15-minute discovery call. In this call, we'll discover the potential benefits from studying the unique patterns in your iris. This call is a chance for me to provide insights and guidance tailored specifically to your needs, whether you're looking to improve some specific areas of the body or simply want to gain valuable insights into predisposed weaknesses, if any. There's going to be various markings and patterns in your iris that's unique to you, and I'm here to help. I look forward to connecting with you and embarking on this journey towards optimized health. For those who want a full iris analysis, I can look at all the systems of the body, including the endocrine-exocrine system, urinary system, digestive system, integumentary system, skeletal system, and any brain weaknesses, if any. You can send me an email with your iris photos on the link below, and I can contact you as soon as I become available. Please like, comment, and subscribe to my channel for more videos like this. And thanks for watching. All the best, and let's unlock the key to health through the iris. Bye for now.